Okay, so you know you're busy, right? And you want to get right to the important stuff, like right away. We get it. So let's just jump right in. Today we're diving into, well, a headline really. Michigan's first confirmed measles case for 2025.
And you know what's interesting? Like what starts out looking like just a local thing,
Hmm.
it really opens up this whole conversation about how connected, like globally connected we all are and, diseases that can spread.
Yeah, exactly. So this CBS Detroit News report from March 14th, 2025, that's our main source here. And we're not just going to read it to you. We really want to unpack it, what it means for you, the listener. So Oakland County, Michigan reporting its first measles case of 2025.
Okay, so that right there tells us a couple of things right off the bat. First of
Yes.
all, it's the first case this year in Michigan, right?
Mm.
So that means they've managed to avoid any cases until now. And also, it gives us a specific place where public health, they're going to be focusing their attention.
Right. Okay, so the report goes on. It gives us some specifics about the person who got sick with measles. So it's an adult, lives in Oakland County, and they recently traveled internationally. But here's the thing that really jumps out. Their vaccination status is unknown.
Oh, yeah, that unknown part, that's huge. I mean, it really shows one of the biggest challenges in public health,
Yep.
right? Like reaching people who maybe they haven't had, consistent access to vaccines, or maybe they just chose not to get them. And in a world where everybody's traveling more and more, that can really create a way for diseases like measles to pop up again in places that had, high immunity before.
And then there's this timeline. This is important too. It tells us when this person was actually contagious and where people might have been exposed. So March 3rd to March 11th, 2025. That was the infectious period. They got the rash on March 7th and went to the doctor March 8th and then again on March 10th.
This timeline is super important for contact tracing.
Yeah.
You know, that's what public health teams do. And what's really wild is that with measles, you can actually be contagious for 4 days before the rash shows up and then 4 days after. So you could be spreading it around without even realizing you're sick.
And speaking of spreading at those locations where people might have been exposed, that's super important information for you listening, especially if you are in any of these spots around those dates and times. So Cruz and Muir on Main in Rochester, Michigan, March 3rd, between 5:30 p.m. and 9:30 p.m. Then there's the Henry Ford Rochester Hospital Emergency Department, 2 different times there, March 8th, 3:40 a.m. to March 9th, 9:32 a.m. And then again, March 10th, 8:30 a.m. to 5:30 p.m.
Yep. Those are all public places, right?
Yeah.
So a lot of people could have been exposed potentially. That's why these announcements from public health are so important. So if you were at any of those places during those times, and especially if you don't know for sure if you're immune to measles, well, pay attention to what the health officials are saying.
Yeah, so let's zoom out a little bit, get the bigger picture. As of March 14th, 2025, the CDC reported 301 confirmed measles cases in the U.S. for the whole year. That seems like a lot kind of early in the year, don't you think?
I mean, yeah, it does. And while one case, it's a big deal for that local community, but seeing it in the national picture really shows us that measles, it's not just an isolated thing. It's still spreading around in the U.S. and then people travel and it can end up, popping up in places like Michigan.
And the report doesn't shy away from how serious measles can be either. I mean, they mention a couple of really sad cases recently. So February, a child who had measles in West Texas, they were hospitalized and they actually died. And then in March, an unvaccinated person in New Mexico died and they tested positive for measles. This is a reminder that measles, it's not just, a mild childhood illness.
Right. And it's easy to think of it that way, but those are real people. These cases really highlight that measles can lead to serious complications, especially for people who are more vulnerable, like little kids, pregnant women, anyone with a weaker immune system. It's a big deal, and we're living in a time when there's a lot of misinformation about vaccines out there, and that can lead to lower vaccination rates. And that's scary.
Which brings us to the most important thing we have against measles: vaccination. Specifically, the MMR vaccine. Health officials are saying everybody who might have been exposed and who isn't immune should get vaccinated. They even quoted Dr. Natasha Bagdasarian, Michigan's chief medical executive. She said, "Vaccination remains our best defense against measles and is highly efficient at protecting individuals and preventing outbreaks."
That's it. That's the message. MMR vaccine has been around for a long time, and it's safe, and it works. Prevents measles, mumps, rubella. And it's not just about you. It's about herd immunity. That's when enough people in a community are immune that it makes it hard for the disease to spread. So it protects people who can't get vaccinated too.
So who's considered immune? They lay it out in the report. People who have had 2 doses of the MMR vaccine. Adults born before 1957, because back then pretty much everybody got measles. And anyone who has proof that they had measles before.
That's how they define immunity.
Yeah.
If you're in one of those groups, you're much less likely to get measles. But if you're not sure about your vaccines or if you had measles as a kid, check with your doctor. They can help you figure out if you're protected.
So measles spreads really easily, right? The report calls it highly contagious, and it spreads through the air like when someone coughs or sneezes, but also just from person-to-person contact. But here's the thing that really got me. The virus can live in the air for up to 2 hours, like wherever that infected person was. That's crazy.
Airborne transmission. That's why measles is so contagious. It just hangs out in the air even after the person who is sick is gone. So for up to 2 hours, anyone who goes into that space could get it. That's why ventilation is so important indoors. And just being aware of where you've been even after the fact.
Okay, so let's say you think you might have been exposed. What should you be looking out for? Symptoms usually show up 7 to 14 days after you were exposed, but sometimes it can take as long as 21 days. First thing is a high fever, and I mean high, over 104 degrees Fahrenheit. Then you get a cough, runny nose, red, watery eyes. That's called conjunctivitis.
And those early symptoms, it's easy to think you just have a cold or the flu. But with measles, there's a couple of things that are more specific that you can look out for. Tiny white spots inside your cheeks. On your gums, the roof of your mouth, those are called Koplik spots. And they usually show up 2 to 3 days after those first symptoms. That's a pretty clear sign it could be measles.
Yeah, those Koplik spots, doctors look for those.
Right.
And then a few days later, usually 3 to 5 days after those first symptoms, you get the rash. Red, raised, blotchy. It starts on your face, usually around your hairline, and then spreads down your body like to your trunk, arms, and legs.
The way the symptoms happen, like one after the other, that actually helps doctors figure out if it's measles. It doesn't all hit you at once. First, you feel like you have the flu, then those Koplik spots, then the rash. It's a pattern.
Okay, so what are the recommendations now? The Michigan Department of Health and Human Services is saying everyone who hasn't been vaccinated and is 1 year old or older should get the measles vaccine. Dr. Bagdasarian even issued a travel advisory. She wants Michigan residents, especially people who are planning to travel, to check their vaccination status and get the MMR vaccine if they need it.
That travel advisory, it's so important. We live in a global world now. You travel internationally, you might get exposed to diseases that aren't really a problem where you live. Getting vaccinated before you travel protects you, but it also helps prevent you from bringing those diseases back home with you. Like Dr. Bagdasarian said, this case is a reminder that this disease, it's highly contagious and it can spread really easily, especially with so many people traveling internationally. That's something everyone listening needs to keep in mind.
Absolutely. So a quick recap of what we covered in this deep dive. The first confirmed case of measles in Michigan for 2025. It's linked to international travel, and we don't know if the person was vaccinated. We talked about the specific places and times where people might have been exposed, and we looked at how many cases there have been in the U.S. already this year, and we talked about how serious measles can be. We emphasized how important the MMR vaccine is. It protects people and prevents outbreaks, and we explained how measles spreads so easily and what the symptoms are. The big takeaway: get vaccinated, especially if you're planning on traveling.
And if we take a step back and look at the big picture, this one case, it shows us how important it is to have strong public health systems. We need to be able to identify and investigate any suspected cases quickly. And vaccination is crucial. It's how we keep diseases like measles under control.
So here's something to think about. Our world is so interconnected now, and diseases like measles, they're still out there. So what can you do personally to protect yourself and your community? And I'm not just talking about vaccination. What does it mean to be a responsible person when it comes to public health? That's something we all need to consider.
It really is.
Thanks for joining us for this deep dive. Stay safe out there.
Absolutely. Stay healthy, everyone.
And we'll catch you next time.